5 on your health tonight, a new warning about a whipped cream product. Here to explain is Dr. Scott Hadlen, Chief of Adolescent Medicine at Mass General for Children. Dr. Hadlen, thanks for being here.
Nice to see you.
All right, a lot of folks have seen these chargers before. Some people call them whippets. They contain small amounts of nitrous oxide, which is good for adding fluff to homemade whipped cream. But how do kids misuse them?
Right, they certainly are misused. The way that kids misuse them is that they'll inhale the nitrous oxide from these canisters. That nitrous oxide quickly goes to the lungs, enters the bloodstream, and then goes to the brain and actually causes levels of oxygen to dip down low. This combination of things leads to this feeling of being kind of dissociated from reality, makes you feel a little bit silly, makes you feel a little bit dizzy. And so that's what causes people to want to misuse them. And of course, this new warning is really about an old problem. You know, these nitrous oxide containers have been around since I was a teenager, since my parents were teenagers. And so we know some of the long-term harms of these. We know that when you use them repeatedly, you can develop long-term neurologic problems, including numbness of the hands and the feet. You can develop ringing in your ears. And of course, you know, I care for patients who struggle with addiction related to these as well. So they're very serious.
Yeah, well, and what's also concerning is anyone, including kids, can buy these canisters pretty much anywhere. They're not regulated as a drug, so I imagine that's a big part of this issue.
That is a big part of it. And in fact, the age group for which these are the most popular is really sort of the younger adolescents, the 13 and 14-year-olds. In fact, national data suggests that at this age, across the country, about 1 in 25 13 or 14-year-olds has used one of these in the last year. And I think a big part of it is that they are so widely available. You can find them not just in stores, but in your own home, in the kitchen drawer.
And the chargers are small, they're easy to hide. So what else should parents be on the lookout for?
Right. Well, that's definitely one thing parents should look for, right, is empty cartridges or noticing that cartridges have gone missing. A lot of the patients that I care for that use these inhalants or nitrous oxide will also inhale other things. So they might also be inhaling glue or paint or, you know, kerosene or other sort of household chemicals. And so sometimes they'll also have a little bit of an odor on their clothing or on them if they've been, you know, huffing these things. And so that's another thing that parents can look for. You know, nitrous oxide itself doesn't have an odor, so it can be quite hard for parents to notice and find out about. And so this just comes back to the thing that we say time and time again, and that is that parents really need to have open conversations with their kids and teens about drugs and ask them what they're seeing, what their peers are doing, and ask if they've ever experienced pressure to try to do these things themselves.
Okay, something to look out for sure. Dr. Scott Hadlen, thanks as always. Have a great weekend.
Thank you.
You too.